Okay, so today we're going to go over the case studies for chapters 25 and 10. And so we're going to start by looking at cerebral palsy. So Rosalind, a 5-year-old female, was born with cerebral palsy, a form of brain damage. She suffers from specific learning difficulties and has stiffness and spasticity in both her gastrocs. Her muscles are stiff due to the somatic nerves innervating them are overactive. The overactivity is due to damage to the motor neurons in her brain. In order for her to relieve her muscle spasticity, Rosalind's gastroc muscles were injected with botulinum toxin. Botulinum toxin targets the neuromuscular junction. It prevents the fusion of synaptic vesicles to the presynaptic membrane. So question number 1, why would excess signaling by somatic nerves cause a muscle to be stiff or spastic? So our answer here is that excess signaling from a somatic nerve results in more frequent depolarization of the muscle cell. So that would produce a more frequent or even a constant contraction of the muscle cells, resulting in a stiff or spastic muscle. The increased frequency of nerve signals to a muscle will increase the overall degree of muscle contraction. The muscle is being stimulated or it's being depolarized more frequently. So if it's depolarized more frequently than it should be, and the muscle is going to appear stiff or spastic. What are synaptic vesicles and what do they contain? So we know that a synaptic vesicle is a small membrane-bound organelle. It's found in the presynaptic axon terminal. And at the neuromuscular junction, those vesicles contain acetylcholine or ACH. Number 3, what happens to the synaptic vesicles when an action potential reaches the presynaptic cell membrane of the axon terminal at the neuromuscular junction? Well, an action potential at the presynaptic cell membrane causes the voltage-gated calcium channels to open. Calcium ions enter into the axon terminal. This results in the binding of synaptic vesicles containing acetylcholine to the presynaptic membrane, and then they release that ACH by exocytosis into the synaptic cleft. Question 4. What will happen if synaptic vesicles are unable to bind the presynaptic membrane? How will this affect the contraction of Rosalind's gastroc muscles? So, if the synaptic vesicles can't bind to the presynaptic membrane, then acetylcholine will not be released into the synaptic cleft. Therefore, there will be no more depolarization of the postsynaptic membrane and no release of calcium from the sarcoplasmic reticulum, and thus no muscle contraction. Number 5, if the gastrocnemius muscle were stiff and spastic, which position would Rosalind's foot be in? And think about the normal role of the muscle. So the gastrocnemius is a powerful plantar flexor of the foot. So that means it causes you to point your toes. It helps propel the body forward during the push-off phase of walking. And if the muscle were stiff and spastic, Rosalind's foot would be in plantar flexion. So basically, she would be walking on her toes if she could walk. Case study we have here is on anesthesia. Reggie, a 48-year-old factory worker, was being anesthetized prior to an operation. During the induction of the anesthesia, Reggie received a dose of rocuronium, a non-depolarizing neuromuscular junction blocking agent. ROC competitively blocks the postsynaptic receptor at the neuromuscular junction and therefore prevents the activation of the receptors by the normal signaling molecule. So again, what and where is the neuromuscular junction? That is between the nerve and the muscle cell. What substance or neurotransmitters normally involved in conveying signals across the neuromuscular junction? Again, that's acetylcholine. Explain how the substance named, so explain how acetylcholine normally transmits action potentials across the neuromuscular junction. Acetylcholine binds to the postsynaptic cell. That will open up sodium-gated channels. Sodium will move into that postsynaptic cell, and then the postsynaptic cell, which is a skeletal muscle in this case, becomes depolarized, and when it reaches threshold will create an action potential. What will happen to Reggie's muscles when he is given rock? And explain your answer. So what we said was rock competitively blocks the postsynaptic receptor. So it's blocking that sodium-gated channel. It doesn't allow for the sodium to enter into the cell, so the muscle cell can't depolarize, which is why we call it a non-depolarizing neuromuscular junction blocker, because it's not even allowing that muscle cell to depolarize. One way to reverse the effect of rock is to increase the levels of ACH, because rock and ACH are competing for the same exact receptor. And the one that's going to win is the one that's in higher concentration. So one way to reverse the effects of rock is to increase acetylcholine, since they're competing. And if you increase the concentration of acetylcholine greater than rock, then acetylcholine will win and the person will regain control of their muscles. What normally reduces the levels of the signaling molecule found in the neuromuscular junction? Well, acetylcholinesterase is the enzyme that's found in that synaptic cleft that will remove acetylcholine. Based on your answer to question 5, what could you give Reggie to reverse the effect of rock? Well, you would just give him more acetylcholine, because acetylcholine, once it's higher in concentration than rock is, then acetylcholine will win and the person will start to regain control of his muscles again. Hyperlipidemia. Scarlett, a 55-year-old woman, was diagnosed with atherosclerosis and hyperlipidemia. Her LDLs and triglycerides were elevated and her HDLs were low. A normal level of serum LDL would be less than 100 milligrams per deciliter. Triglycerides would be below 150 milligrams per deciliter, and HDLs would be over 50 milligrams per deciliter. What's the function of LDLs? LDLs deliver cholesterol to the peripheral tissues. So they're picking up all of those lipids from your digestive tract and delivering them to the peripheral tissues, and they can build up plaques in your arteries. They're kind of known as the bad cholesterol. How does the liver control and distribute lipoproteins? So the lipoproteins are the LDLs, the HDLs, the intermediate density lipoproteins, the very low density lipoproteins. So the liver plays a central role in lipid metabolism. It serves as the center for uptaking lipoproteins from the blood, and then from forming them and then exporting them to circulation. So it forms these lipoproteins, it releases them into the bloodstream, and then it takes them back and can even break them down. So why would Scarlett be advised to lower her daily intake of cholesterol? So cholesterol is used to produce these lipoproteins, produce both the good and the bad lipoproteins. So by reducing her intake of cholesterol, she would be able to produce fewer of the LDLs, or the bad lipoproteins. Hypothermia. You and 3 friends are on an early winter ski trip. To shorten the route, the group decides to cross a lake, despite previously agreeing to avoid the lakes due to thin ice. About 20 yards from shore, you warn the others of funny ice and suggest the group turn around. As you stop to talk it over with your companions, you break through the ice and sink up to your chest. However, the sled you're towing keeps you from falling through. You unbuckle your pack, detach it from your sled, but then slip into the water up to your chin. You struggle for a few minutes, gasping and hyperventilating, before you realize you are standing on the lake bottom. After calming your breathing, you release the ski bindings, and with the help of your companions, you crawl out of the water onto the ice and away from danger. The light's fading as the sun sets. It's 15 degrees Fahrenheit. Your clothing and hair quickly freeze. You are shivering. What are your body's mechanisms to promote heat gain and prevent hypothermia? So the body has both cold and warm thermoreceptors that detect change in temperature. And there's more cold thermoreceptors than there are warm thermoreceptors. But these thermoreceptors send signals to the hypothalamus. The hypothalamus is the control center of the brain for thermoregulation, and it receives this signaling from these skin thermoreceptors. The hypothalamus then will signal the blood vessels to vasoconstrict by contracting the smooth muscles that line the blood vessels. This diverts blood away from the periphery, where the cold water is, and kind of shunts that blood toward the depth of your body to try to keep it warm. So what is the function of the heat gain center? 17, what is the function of the heat gain center? So the heat gain center prevents hypothermia. It is going to activate the sympathetic nervous system, which will decrease blood flow to the dermis by it vasoconstricts those blood vessels, and then it diverts the blood to the deep veins to trap the heat to the core. What is the function of the vasomotor center when your body temperature falls below normal? So the vasomotor center, when your body temperature falls below normal, is going to activate the sympathetic nervous system and cause those peripheral blood vessels to constrict, and will divert the blood from where your skin is down into your deeper core. How does shivering thermogenesis increase body temperature, and how much can it raise body temperature? Shivering thermogenesis is increasing your body temperature by shivering, because as you're shivering, your muscles are the ones that are contracting, and in order to contract, they are using oxygen and energy. As more ATP is produced, more heat is produced. Heat warms the deep vessels and can generate heat by more than 400%. How does shivering thermogenesis increase body temperature? How much can it raise body temperature? So again, it is increasing body temperature by increasing ATP production, and anytime you increase ATP production, you are also increasing heat production. So it's going to be able to raise it immediately. Shivering thermogenesis is going to increase your body temperature up until it gets to normal body temperature, which is 37 degrees Celsius or 98.6 degrees Fahrenheit. And at that time, shivering will then stop. Why wouldn't shivering thermogenesis be helpful in this situation? Well, non-shivering thermogenesis is a longer-term process. And in this case, this person, you, need to increase your body temperature rather rapidly and don't have time in order to develop that heat, because non-shivering thermogenesis takes days or weeks for those hormones to increase heat production. All right, then this ends our case studies for chapters 25 and 10.